Okay, we are going to get going for this lunchtime slot on possibly a day where it's the worst time to invite an external speaker to find car parking on campus. No, it's a huge pleasure. For those of you that I haven't met before, I've been person over the summer talking to you about a summer of women's sport. My name is Dr. Verity Postlethwaite. I'm a lecturer in strategic event management. I know nothing about medical equity to a certain extent, but I have had a pleasure of conversating, meeting, doing really fun things the past 12 months with Dr. Karen Jones, who is England Rugby Clinical Services Lead. And Karen very kindly, for those online and for those in person and for those watching back to the recording, agreed to do this National Centre for Sport, Exercise and Medicine public lecture the week of the Women's Rugby World Cup final. And Karen told me on the walk down, Karen is working at said final. So we're so lucky and so grateful, Karen. Cannot thank you enough. But just to underscore to you the strategic importance of this to date will be globally the most successful women's rugby event and arguably women's sporting event since the 1999 FIFA Women's World Cup. This goes above Australia and Aotearoa New Zealand's 2023 Women's Rugby World Cup and other events. So again, having someone that has literally been working at it and also is trailblazing a lot of women's health and female athlete health in the UK, I'm really excited, Karen, and I've bigged you up and hyped you up as much as I can. No, it's super relaxed today. As you can see, you've got a lot of people in front of you that are just really keen and interested to hear what you have to say. Thank you, Karen.
Fantastic. Thank you, Verity. I'll just see if I can minimise this here. That's all right. There you go. Perfect. So, hi everybody. Firstly, thank you to Verity and the team for inviting me to speak today. I saw the title that Verity gave to me and thought, that sounds a really interesting lecture. I'd quite like to go, and then realised that I had to deliver it. So, we've been working closely with Loughborough for some time at the RFU, and are really excited by the work that's going on here, pushing the agenda for women's sport. So, hopefully, no. It was working a minute ago. If I go in the wrong way.
No, it's because you've clicked on that other pesky thing.
Doesn't like me.
Click back on your slide.
Click on the map and that will work. It all went so well. Right, I'm going to start with a little video.
This is for the girls who were told this game wasn't for them.
For the girls who laced up their boots when no one was watching.
For the girls who refuse to be defined by limits, who run towards obstacles.
This is for the girls who battle beside us.
Who lift us higher.
The girls who know that true strength comes in different shapes and sizes.
For the girls
and the guys who support us.
Roses are red, roses!
This is for the girls who pioneered before us, who stand with us now.
and for the girls who will follow
And
us.
tried everything to stop her going!
This is for you.
Roses!
All of you.
This is for the girls!
So, if I can go on. This worked perfectly beforehand. There we are. Perfect. So, for any of you, those of you who haven't been awake over the last few weeks, we're in the middle of the Rugby World Cup. So, as Verity said, it's coming up to crunch time. We've got the final this weekend. So, it's going to be Canada versus England at Allianz Stadium in Twickenham. I'm very excited about it. I'm a little bit nervous about it. It's not a given. It's going to be an absolutely cracking match for anyone that watched the semi-finals last week. And I think we support for both teams. Whatever happens, I think there's going to be a win for women's rugby. So just to give you a bit of background on the World Cup, this is the first time the Women's World Cup has had 16 teams in it. So previously, it's been a 12-team tournament. This cycle, it was opened up to 16 teams. And that's led to some interesting challenges. So Canada, who were in the final, have part crowd-funded in order to be here. Samoa have had to take time off work to be here. So we've got a real mixture within the teams of full-time professional outfits, like England, and teams that are not full-time professionals at all. What we can see is the growth of the game between New Zealand 2021, up there in the top right-hand corner, and England 2025. So New Zealand 2021 actually happened in 2022 because of COVID. So a total of 140,000 tickets were sold for the entire World Cup. We're over 400,000. And for the final this weekend, we've already sold out Twickenham. And they could have sold it half again. At least 40,000 people are on the waiting list for tickets. And that's not including people that's been put off. So the growth is incredible. Back in 2010, the last time the World Cup was in England, we had 13,000 people at the World Cup final at the Stoop, and suddenly we're going to have 82,000, which is really exciting, and it's a real step change. The BBC has hosted the World Cup and has been an incredible partner. They've had it across everything. I mean, it's been on Bargain Hunt, it's been on Songs of Praise. And so my ex-colleague Anne O'Flynn got a phone call to say, would you like to be on Songs of Praise? I was, well, yes, let's do it. Let's get it out there. It's been on every single channel and it's really raised the profile, which is really exciting to see. How does that reflect into the PWR space? The PWR is Premiership Women's Rugby. And we can see that in the last season, there's been an 86% rise in average television audiences on TNT Sports. So massive change. And there's been a massive increase both in PWR YouTube viewing and also in TikTok views. 91% rise in TikTok views. Probably largely related to Ilona Maher coming into the UK. So Ilona's a very high-profile American rugby player who came and started to play at Bristol Bears this season. There's still a way to go in PWR to get the face-to-face audiences, game day audiences appearing. So it's going to be fascinating to see how the audience attendances at the Rugby World Cup translate into the Premiership Women's Rugby attendances post-World Cup. So I probably ought to introduce myself. I come from a bit of a varied background. So my sporting background was actually in rowing originally. I went to university as a rower, competed for my university in the boat race, and then got a bit bored of rowing, and a friend said to me, come and try women's rugby. So I went along to women's rugby, became addicted almost instantly, and went on to play for England. I was capped more than 30 times for England, was very privileged to have had the opportunity to captain England on a few occasions, and all that happened whilst I was a junior doctor. So I started playing my second year as a junior doctor, continued working through to when I became a registrar, and did the two roles side by side. When I stopped playing for England Rugby, I continued my Premiership club rugby and played at Worcester towards the end of my career. And at that point started thinking, well, what do I do next? I was an emergency medicine doctor, about to become an emergency medicine consultant, and I thought, well, I don't want to lose rugby, so I went into sports medicine and didn't really look back. And for the last 12 years, I've been working, give my age away, I've been working as a club doctor initially for Worcester Warriors, and now I work for Gloucester Men. Outside of the women's game, not doing very much related to women's sport. 2 years ago, I stepped back into the RFU to take on the role of clinical services lead. And my role now is overseeing all the medical teams for men's and women's, all the way through from pathways to seniors, and supporting their development and the way that we support our athletes. When I first started at the RFU, I asked the question, so what's our women's health strategy? So there was a bit of silence, and I became the female athlete health lead for the RFU. So never ask a question that you're not willing to follow up. So I now work with Kirsty Goldie-Brammer as leading up the female athlete health team at the RFU. We've been working hard to implement a strategy for how we improve what I'll come to, which is medical equity in the women's game. So what is medical equity? So when I got the title from Verity, I thought, right, I need to think about what this means and what the academic term for it is. So if we look at health equity, the World Health Organization has given us a nice definition. So it's the absence of unfair, unavoidable or remediable differences in health among population groups. Okay? So if we think about equity versus equality, equality is giving everyone the same resource. So that would mean, you know, if I get one thing, Verity has to get the same, you have to get the same, everyone in the room gets exactly the same resource. But equity is slightly different. Equity is about giving people what they need to get the same health outcomes. And I think this is really, really key to women's sport. So when we look at performance sports medicine, there isn't really an accepted definition. There's nobody I can quote as giving a definition, so this is my definition, and something we use at the RFU. So performance sports medicine for us at the RFU is the proactive management of athlete health to facilitate both optimal performance and to minimise risk. So if we take that definition and put it towards medical equity, we basically need to give athletes what they need in order to reach the same performance outcomes. And I think that's really, really important, and I'll come to why. So my perspective on tackling the medical equity gap is threefold. I think we need to drive improved access to medical resources. We need to deliver data-driven care for female athletes. And we need to think about difference and how we meet those female-specific health needs. And I'll come on to those. So if we start with the first bit, equitable access to medical resources. The challenge in women's sport has always been money, and will continue to be money. It has been shown by the Red Roses that if you invest in a side, then the revenue will come. Okay, so we got to a position where a few years ago people said we would never fill Twickenham for a women's rugby match. We're now, thankfully, at the position where that's going to happen on Saturday, which is massively exciting. We've also had women's fixtures through the Six Nations at Twickenham, and they're not losing money. They're not making money yet, and this Rugby World Cup probably won't make money, but it's not loss-making anymore. And that's earlier than expected for women's rugby. The growth has been unexpected. We have to invest to prospect in women's sport, and I think that's something that unions, national governing bodies need to understand and are starting to understand. And I'm very proud that the RFU was the first women's rugby national governing body to have a full-time professional women's side. And we have to do the same for our medical resources. So at the moment, yes, the money isn't the same in the men's game and the women's game, but we have to make sure that we get access for our elite athletes to the medical care that they need. Now, how can we do that as a governing body? We can talk about minimum standards. So driving minimum standards across different leagues. So what is right potentially for an international setup may not be quite the right model to have at a club, in a club rugby setting, or a semi-professional club rugby setting, and it certainly won't be right for club settings. But I think we have to think about what resource we can access, and it doesn't always have to be financial. So medical resource can also be getting access to the right information. And we're doing a huge amount of work at the RFU to make sure that there are resources out there so that grassroots clubs can access injury prevention information, concussion care information, female health information. The second thing that we need to do is think about data-driven care. So for people in the room, what percentage of sporting academic research is done on female athletes for female athletes? I know there's a few people here that know.
We probably all contested it.
Excellent.
Yeah, definitely a few people that know the one you're on about.
So we're talking probably, I think that the figure is around the 6% mark. Do we agree with that? It's probably not correct anymore, let's hope. Particularly with Loughborough coming into existence with your female sport hub, women's sport hub. But I think it's a problem, okay? More than 50% of women, of athletes, people participating in sport are women. And yet a fraction of research is done on athletes, or on female athletes. The challenge that we've got is that most of the protocols and guidance around any kind of care for athletes is based on your 70-kilogram man. Okay, so when we are looking at how we rehabilitate somebody with a neck injury, how we rehabilitate someone with a shoulder injury, the data that we're dealing with is based on male athletes. And that can be really challenging when you're looking at normative data. So actually, what do we need to get back to? What is optimal shoulder strength for a female rugby athlete? We're having to build that database ourselves. And the clinicians working on the ground are building their own evidence base as we go. So how do we improve that? So we need to start collaborating. There's a few things going on behind the scenes to try and close this gender data gap. So there are collaborations with Loughborough, for example, with other universities that are now going into the female health space in sport. But we also need to think about driving it as sports to ask the questions that we want. Because so often in sporting research, it is done from an academic side, and then it's then waiting for the sports to catch up and implement it. Now, the average time for medical research to be translated from academic research to delivery is quoted as being 17 years. Now, I hope that's not true anymore with the internet and other things going on. I think it's probably not true. However, we're not good at it. And sometimes that comes because the question that's being asked about academic research, or the question that's being asked, it comes from academic researchers rather than people like myself, like Lewis Jones, our Red Roses doctor, who are there on the ground trying to deliver something. So the more we can collaborate between academia and sport to set the questions and get the questions right, the better. I'm working as part of a new group called the NGB Collective, so the National Governing Body Collective. And this is a group of women's team sports that all have a similar aim. And so what we want, we're all looking to try and improve female health equity within our organisations. So it's the FA, the ECB, England Netball and the RFU have started conversations. And one of the things on our list is how can we work out what our research questions are? And then how do we get those research questions out into academia? So yeah, please, if you have the answer to that, I would love to hear from you. The challenge for women athletes is that they so often have been treated as small men. Certainly when I played, if someone had suggested to me that I ought to do something differently to my male counterparts, that I ought to use a smaller rugby ball, that I ought to perhaps think about something to do with my femininity, that would have been absolutely not accepted. I can tell you now, if someone had come to me, and I know this from my colleagues, and said, Karen, we think women's rugby should use a 4.5 ball instead of a 5. I've said, no, we need equality. We need to be the same. We need to be equal. Because we fought so hard just to have a seat at the table. When I played, the RFU women's was not part of the main RFU. So we fought so hard, but fortunately we're not at that position anymore. Now we need to start thinking that women are not small men. Women's rugby players are women's rugby players. We have difference. And we need to start thinking about how we've got the data to support that. A really interesting example of this is around sudden cardiac death in sport. So when you look at the data, there's probably about 3-fold reduction in the risk of sudden cardiac death in women athletes compared to male athletes for various reasons. And I don't think we understand all of it yet. So when we're thinking as national governing bodies about setting up our cardiac screening programmes, we need to be aware of that data, because actually you have to prioritise, as national governing bodies, you have to prioritise where you put your resource. Now, if we go for the equality side, we would say, right, whatever the men are having, the women are having. But actually, when you're balancing resource, it may not be appropriate to have exactly the same cardiac screening programme. And therefore, you have to think about, well, what is the risk in this group? What is the risk in this group? And what is the solution that fits best? And cardiac screening is one example, but there are many, many other examples of that within women's sport. The second question I have is around translation. So we've talked already about how we translate across into women's sport. We have to find a way to do better. So we have to find a way to work with academic institutions of sports and find out the latest evidence and bring it to life for our athletes. We have to get the data from research through to the athletes more quickly, which is easier said than done, because you have to get it from research to national governing bodies, to clinicians, to athletes, to coaches, etc., etc. And I think that's something that we historically have been bad at, but we need to improve it if we're going to close this gender gap. One of the most important things I think about female medical equity or women's sport medical equity is that we need to start closing the lack of resource around female-specific health needs. So female-specific health needs are basically anything female health related that impacts on your performance. So we're talking bra health, breast health, we're talking menstrual health, we're talking pelvic health, and we know that these are really big topics. From my perspective, we need to stop viewing female health as a female athlete issue. Okay, an issue for female athletes. So we must start saying this is a female athlete issue, not an issue for female athletes. Now it's a really important distinction, because if it's an issue for female athletes, then it's up to the female player herself to go and find a solution to solve the problem. We make it a female deficit, and we have the approach that women perhaps are not as much because they have these female athlete health issues, and that's certainly not the case. We also, the female athletes can't solve it on their own. It has to be a system approach if we are going to be making real inroads on this. So from my perspective, if you're going to address female health, you have to do it systematically, and this is the approach that we're taking at the RFU. So this is our RFU female health domain piece. So what we first did when we started to think about our female health strategy is we mapped out, well, where does it impact? Which parts of our business need to know about female health, and where does it need to fit in? And you'll see that there's a great spectrum in there, of which clinical care is actually a very small part. So it needs to not be medical, it needs to be whole system, and it needs to be owned by the sport and not owned by the athlete. Governance is a really key part of our strategy. So we need to get it onto our strategic plan. So the RFU strategy, we're working hard that the next iteration will have female athlete health built within it and the way that we're going to support. And that's really important because that influences the way the game is funded, supported, where the priority focus areas are. At the top of this figure is awareness. Now, awareness of female health is something that needs a lot of work. I think if you think about female health conditions, it starts perhaps becoming a problem at school. So for all of you, I imagine, will have gone through school. You'll all have had your sex education lessons, your PHSE as it's now known. And what would happen is you would have your educational sessions, and at some point all the girls would be taken off by a teacher into a private room. They'd all come out again with their little package of something. It would all be hush-hush, no one would know anything about it, and the boys, this isn't something that the boys are taught to about. Why? Why are we not talking to men about periods? How can we expect men to get through life without knowing about breasts, periods, pelvic floor? I mean, it seems crazy, doesn't it? That actually we're setting our boys up to fail. These boys who are not being taught about periods at the age of 10 or 11, they're going to be fathers, they're going to be husbands, they're going to be coaches, they're going to be medical staff. They're all going to have roles which will bring them into contact with females, and they need to know how to interact with. They need to understand it, and they need to know how to have conversations and feel comfortable having a conversation. I had a very interesting conversation with a fellow doctor when I was a junior doctor, and we were talking about menstrual products and the need for women that had very heavy bleeding, and how you worked out whether someone was having menorrhagia, so very heavy periods or not. And we talked about tampons and different, the fact that, well, it's important that you know whether they're using a regular, a super plus. And I said, oh, I just thought it was related to the size of the person that you were putting it into. So we did explain that it's to do with flow rate and not anatomy. But that's a doctor. That's somebody who's got through their whole life without understanding quite how female health works. So our approach to awareness has to be the most important thing. And when we talk about translation, I think translation is where awareness is where translation happens. We cannot do anything unless we get people comfortable with talking about things. At the RFU, I'm very fortunate to work with two brilliant women, Rachel Fall-Brown and Chrissy Clark, from the player welfare team within community rugby. And they've done a huge amount of work putting together player female health toolkits. And off the back of that, they've created a female health champion programme. So they've trained up women who are not female health experts to deliver female health education sessions out into community rugby. And they're not experts on female health, but they're there to make people feel comfortable, allow people to ask the right questions, and deliver centrally designed education out into club settings. And that's part of the way that we're trying to translate and raise awareness. We have to get to the situation where coaches stay in the room. So often, if there's a female health issue, it's back to school, the boys go out of the room and the girls stay behind. That can't happen. We have to make sure that everyone's comfortable. And I'm not saying that for under 18 girls they have to sit there squirming next to their head coach who's a male. That may not be appropriate, but everyone has to be on the journey. We have to get to the point where everyone can be in the same room as each other. Education is key. Now, when we talk about female health issues, there's loads we don't know. So we don't know exactly the impact that menstrual cycle phase has on injury risk. There's conflicting evidence out there. We don't know exactly what you should do training-wise during different phases of your menstrual cycle. But we do know that people may have symptoms that differ at different stages of their menstrual cycle. We do know that women may have changes in their bra size during the menstrual cycle. So we need to get this evidence out to women now, okay? Because we're not talking about it, or we haven't been talking about it. Now, when I played, female health was simply not an issue. We didn't talk about periods. We certainly didn't talk about stress urinary incontinence. But I can tell you that now that with 60 to 80% of women having stress urinary incontinence who play rugby, certainly my teammates had stress urinary incontinence, and we didn't talk about it. It was taboo. It was hidden. We've got to change that, and we've got to make sure the education is out there. So again, back to my colleagues Rachel and Chrissy, they've done a brilliant piece of work which has been funded through the Impact 25 money. So this is money that's coming from the Rugby World Cup. And what they're doing is creating some online educational resources that will go out to our whole game. Because actually, whether you're a Red Rose or a community rugby player, you need to know the basics of female health. Now, our Red Roses will get extra support and additional one-to-one input potentially for their pelvic health issue, but it doesn't mean that there's a difference in the education that we need to give them. The other parts on our spoke are more about systemic change. So, again, so many rugby clubs, until the last couple of years, didn't have female sanitary bins in their player toilets, which is crazy, isn't it? Women's rugby has been around for a long time. Women have been going into rugby clubs for a long time, and yet there was no female sanitary products there. The RFU's done a great piece of work, again through Impact 25, getting sanitary products out into clubs. Now people say, oh, it's tokenistic, you know, it's just putting products out there. But no, it's not, it's cultural. It's changing the environment to make the environment appropriate and welcoming for women. Women can go into clubs and say, they're actually catering to my needs. We've got a bin present. We've got sanitary products present. This is my space as well. And I think we have to think about that when we're thinking about the culture of clubs as well, and making sure that women want to go into them. From an elite performance perspective, we're looking at this in terms of injury prevention, making sure that we have the right injury prevention programs for our athletes, but also around kit and equipment. So over 50% of women who are playing elite level sport are wearing the wrong size sports bra, which is nuts, isn't it? You just think these are elite athletes who are measured in every other way, and yet they're wearing the wrong sports bra. And I know that you've had talks previously talking about why that's important, both from a female comfort perspective, breast pain perspective, other injury perspective in terms of shoulder, neck, upper back issues, but also performance. We know that it negatively impacts women if they don't have the right size sports bra on. We've been doing a bit of work with Deirdre McGee, who is an Australian breast health researcher who came over earlier in the summer and who I've met on a number of occasions. And she has a very pragmatic approach to how do we translate the knowledge that she has and that other researchers within the breast health space have, and how do we put that into women's sport. For elite athletes, you can get women measured. Okay, it's not difficult to get a company in to come and measure your female athletes for a sports bra. But what happens when that sports bra goes through the tumble dryer and gets shredded? Then they go back to their old sports bra, which actually doesn't fit properly. So we need to not just provide our female players with a piece of equipment, we need to educate them, make sure they know how it works. And then for our community game athletes, actually, how do we get the education out to them? So we led a physiotherapy training session with Deirdre here in the summer, where she came and educated our physiotherapists on how to fit sports bras and how to manage breast injuries. And it's not rocket science. And Deirdre will say this, it is not rocket science. The reason we started with our physiotherapists is we can reach out into both our England teams, we can reach into our Premiership Women's Rugby, into our player development groups. But the next step for us is how do we get that into the community game? And something Deirdre and I have been speaking about is how we can educate trusted females, or trusted female adults, to go and deliver breast education sessions to teams. And that's something we need to look at going forwards. Elite performance, again, we need to make sure that we're doing the right things for our athletes. The athlete-parent piece is really important. So we're not just talking about what happens when you become pregnant, what do you do for your postpartum care, but actually how do we support athletes with their family planning decisions? How do we make sure they've got access to the right information to work out when is the right time for them to have their family, if they choose to have a family, and how do we make sure that they have choice? I don't think, personally, I think it's not the right thing for a national governing body or a sporting organisation to be paying for athletes to go off and have egg harvesting, egg freezing procedures. That seems morally potentially challenging, and I think that's something we need to explore and work out. Personally, I'm conflicted, because should we be saying to women that you should be delaying pregnancy to a time when you're much less likely to become pregnant? That's a challenging argument. But we need to make sure our athletes have all of the facts, and then we need to make sure that if they do choose to have their first child during their rugby career, there is a way for them to do it. They have that support during pregnancy, they have that postpartum support, and really importantly, they have that support when they go back into the environment. So the Red Roses maternity policy doesn't just cover the period of time when they're off from maternity. There's also additional support for how they can continue to support their child when they come back into the environment, bringing them into camps, etc., making sure that we are a family-friendly and inclusive community. The clinical care piece, I think, comes from the data, and we need the data. And then surveillance and research is our other prong, which is really for us about making sure that we're continuing to push, that we're asking the right questions, we're collaborating with academic research institutions, and that we're pushing things forward. So I've spoken a lot today about a lot of different areas. It certainly made me think about how we approach things. If I come back to the three key areas, we need to drive to improve medical resources, be that physical resources or be that educational resources. We must do better at not only gathering data on women's sport, but translating that data so it actually impacts on the care of women. It cannot get stuck in academic institutions. And we need to celebrate difference within our female athletes, and accept that, and celebrate the fact that females are not small men, and make sure we provide them with the resources and the care that they need to meet their female-specific health needs. So I was going to say, please come along to the final on Saturday, but I'm afraid you can't, we're sold out. But it will be live on BBC One, so yeah, please join the, I think it was 3.3 million who watched it last weekend for the semi-finals, so please, yeah, please support. I think women's sport is on the up, women's rugby is on the up. This has been an incredible summer of women's sport, with the Lionesses winning the Euros to defend their title, tennis coming back to Queen's, the 100, the athletics, it goes on, it goes on. So let's hope, we've got one more match to go. Obviously I'm biased and I want it to go England's way, but I think to be honest, whoever wins on Saturday, this has been an incredible achievement for women's rugby. The World Cup has been joyful, and I think that's how it's been described by many within the media, as joyful. And genuinely, the feel around women's rugby at the moment is really exciting. And I really can't wait to see in 4 years' time how far we've come. Thank you very much.